Welcome students to this presentation on stress management. Multiple deadlines, assignments and semester tests are all part of campus life. Therefore, being able to manage your stress is optimal to student success. Now let us examine and look at our own personal stress-o-meters. Where do you experience stress? It is important to identify where your stress or anxiety stems from. Let us first look at academic stresses, like for example, adjusting to campus life, or coping with a number of tests and assignments, or juggling extracurricular activities, and possibly family expectations or pressure. Entering university brings with it social stresses, which may include peer pressure and engaging in social activities, which can both distract you from your academic work but also increase your stress levels. Finally, personal stresses may include family relationships and/or financial concerns. How does your stress-o-meter look? Now we will look at what are some of the causes of student anxiety. Often students are not adequately prepared for tests, or maybe they are unhappy with their final product of an assignment. This may be due to procrastination. Sometimes students' past experiences of blanking out in an exam or failing a test or exam shapes their present experience. Focusing too much on the outcome of a test can be quite harmful, as it leads to negative thinking. For example, thinking a single test is a reflection of my whole academic ability, or comparing myself to fellow classmates or friends. Another example or cause of academic stress is engaging in negative self-talk, like I can't do this or I'm a failure. Finally, personal or emotional concerns can also lead to academic stress. Let us look at an example of how anxiety may affect you as a student. At point 1, let's pretend like a student hasn't worked hard during the semester and has a low semester mark and therefore feels when entering exams at point 2, they feel that they don't have the knowledge to become an engineer. This often impacts the way you feel. So at point 3, you may feel defeated, demotivated, and quite upset. This may then lead you to whine and complain about your studies. For example, why is engineering so difficult? They just want us to fail. You therefore may avoid your work, hence procrastinate. At this point, you may also have other thoughts like, I'm not going to pass, or I can't do this. Right here, you are engaging in a distorted thought pattern, where your thoughts like, I'm going to fail, or I can't do this, are predicting the future. They aren't based on any fact, but are purely negative. It is important to be able to identify how your thoughts impact your emotions and how together that impacts your behavior. Rather than predicting the future, like in this example, focus on the here and the now and what you can do to help yourself at the present moment, thereby being productive and proactive. From the previous slide, you were able to see, like illustrated in this diagram, what you think psychologically affects what you feel, both emotionally and physically, which in turn affects what you do, which is your behavior. It is pivotal for students to understand how anxiety affects you. Take a second and think about this in terms of your own personal experience. Now let's think about how stress affects you personally. From the previous 2 slides, we recognize that stress can affect your thoughts, how you feel, emotions, and your physical state. Some of the symptoms of stress include but are not limited to this list. A negative emotional state, so that is feeling down, angry, overwhelmed, or lonely. This may also result in a decrease in your self-confidence or a negative perception, for example, viewing a test as a threat and wanting to escape it. Difficulty in higher order functioning is also a symptom of stress. Therefore, maybe not being able to make good decisions or plans, feeling confused, panicky, or becoming irritable or impatient are also common to symptoms of stress. Physically, you may also experience symptoms such as diarrhea, nausea, sweating, increased heart rate, and headaches. Once you can identify your anxiety in terms of causes and symptoms, it is important to manage it constructively. Here are a couple of helpful techniques to manage your stress or anxiety. It is helpful to learn relaxation techniques, for example, progressive muscle relaxation and breathing exercises. Please click the attached video link to learn more. You can also engage in exercise, yoga, and stretching. Start to listen to soothing music. There is also a lot of research conducted on the benefits of mindfulness and visualization. Please watch this video for more information. It is pivotal to take care of yourself. Please read through this handout and learn how to improve your self-care. Start to engage in meditation and/or prayer. Always remember to use positive and motivating self-talk, and most importantly, believe in yourself. Please attend one of the Faculty Student Advisor Group workshops or book an individual appointment to learn more about these techniques. Thank you for watching and good luck.